First, I want to extend a welcome to the President, who is coming up to the Capitol today to meet with Democrats on the subject of the health care bill. So far, they've voted to cut Medicare 3 times, cuts they previously described as immoral and irresponsible, cuts that made it impossible for the President to keep his pledge that people who like their plans can keep them, cuts that will reduce the quality of home health care, cuts that will reduce benefits for nearly 11 million American seniors on Medicare Advantage, cuts that raid Medicare instead of fixing it, cuts the American people vehemently oppose. Democrats are in a tough situation on this bill, Mr. President. They want to expand the government's reach into health care, but they don't have the money. And they don't have the support, more importantly, of the American people. So what did they do? They decided to take the money they need out of Medicare, and that's only made their health care plan even less popular with the American people. Now, the Gregg Amendment, which we'll vote on later this afternoon, would help reverse the damage of last week's votes. The Gregg Amendment says that Democrats can't raid Medicare, which is already in serious trouble, in order to pay for their $2.5 trillion bill. The money going out of Medicare's Hospital Insurance Trust Fund already exceeds its annual income. It's already drying up. By 2017, the Hospital Insurance Trust Fund won't be able to pay full benefits, and that's before our colleagues get their hands on it. This program needs to be fixed, not pillaged, to create another one. So the Gregg Amendment prohibits using money from Medicare to pay for any new government programs, for expanding existing programs, or for subsidies. Instead, it directs that any money from Medicare be put back into Medicare to strengthen and preserve it for future generations so that we can keep our promises. Frankly, this is just common sense. Americans don't want this bill to pass, and they certainly don't want it to pass at the expense of the roughly 40 million American seniors who depend on Medicare. The Gregg Amendment would keep that from happening. A vote for the Gregg Amendment is a vote to keep our promise to seniors. We're also going to have another vote today on the Ensign Amendment. The amendment is simple. It is designed to ensure that injured patients, not their lawyers, receive the vast majority of any settlement in a medical malpractice suit. It says that since lawsuits should benefit patients, not lawyers, lawyers can't take more than 1/3 of the recovery their clients receive. In other words, the lawyers can't take more than 1/3 of what the client gets. These are responsible limits. Moreover, they were written by a Democrat and supported in the past by 21 of our current Democratic colleagues, as well as the Vice President. And they would drive down costs, the original purpose of reform. The Independent Congressional Budget Office has said that comprehensive liability reforms would save the taxpayers more than $50 billion. The Ensign Amendment is a step in that direction. And we will offer a better step-by-step reform to end junk lawsuits against doctors and hospitals later in the consideration of this bill. I'm hopeful my Democratic colleagues will support it again, since so many of them have supported it in the past. Mr. President,